Hello, my name is Melinda Arcara. I am a Master's in Applied Nutrition candidate at the University of New England, and I'm going to be presenting my community needs assessment to you about Chester County women over the age of 51 who are experiencing food insecurity. Chester County is a beautiful area. It's 21 miles from Philadelphia, and it was established in the late 1600s and has historical significance dating back to the Revolutionary War area. It was a key area for the Civil War, and many buildings in the area were used as safe havens for slaves seeking freedom from the South as the Underground Railroad. Much of the land in Chester County is still used for agriculture, but many of the large farms of Chester County have slowly been sold and are being converted into densely populated housing developments. Yet, the rural appeal to Chester County has made the region a desirable place to live because of its convenient access to major cities by train and freeway, like Philadelphia, Washington, D.C., New York City, and Lancaster, Pennsylvania. This rural setting has over 144,000 acres of permanently protected land. That's 30% of the county, which makes the area desirable for outdoor activities such as biking, hiking, fishing, farm markets, concerts, and many other activities. But all that comes with a price. The cost of living in Chester County is the highest in the state of Pennsylvania. People make more here, but they spend more on health care, housing, transportation, and gas tax, and they must drive around more than other areas because there's less public transportation. Our property taxes are high, and with that, food is high. The ruralness causes disparity of incomes in the county, which creates pockets of poverty. For every household income below $25,000, there are 3 households with incomes above $100,000. Shockingly, there are anywhere from 43,000 to 80,000 people living in the region in pockets of poverty, and 74% are women, and 53% are women above the age of 51 years. It's these women I am here to talk to you about today and help you understand the nutritional struggles women are faced with now that could affect their future health. So, how does food insecurity happen with such high income? The median household income in Chester County is $100,214, yet the income needed for a family of 4 living in Chester County is $87,817. As you can see, this leaves little cash, $12,397 in this example, to live on. Especially for families with more than 2 children, that is not a lot of cash to be used. The high household incomes make many families in this affluent community ineligible to receive government assistance such as SNAP because the minimum threshold for the state of Pennsylvania is $34,068. This equates to 50% of Chester County food insecure households being ineligible for government food assistance. There is a wide range of estimations that 43,000 are eligible for SNAP benefits in the county, yet 80,000 residents are considered food insecure, mostly women. Participants from a Chester County Food Bank survey stated that people in this region are more than food insecure. They are cash insecure, meaning they have insufficient income to meet the cost of living, and in many cases choose to either pay bills or buy food. Underemployment is also a problem in the area of the county. Chester County has many bedroom communities where people reside, but then they commute outside the area for employment. Chester County has 157,905 households residing on 760 acres, which makes many areas very dense and other areas very rural. Gas taxes are high, childcare is high, food is high, and single-income women don't know where to go for help. So, many women experiencing food insecurity in Chester County are well educated and have good nutrition knowledge, but stigma prevents women in Chester County from accepting food assistance. A food insecure person may feel anxious and or embarrassed having to enter or stand in line outside of a food bank in full view of neighbors, friends, and peers. And food bank stigma may be socially ostracizing. Food insecurity perception is not just about the financial means to purchase healthy food. It's the lack of convenience or accessibility and availability, which in Chester County stems from the rural environment or distance to stores, which could be up to 5 to 10 miles away. Food insecurity perception can also stem from stress from unplanned or unexpected needs and barriers to food distribution, such as transportation. Some women may be prevented from going to a food organization because of spousal fears and that friends and neighbors may view him as a failure as a provider. Research on community interventions such as food banks has little impact on high-income county food insecurity. Combating these perceptions and preserving good health is the key to disease prevention. Key informant interviews were conducted for this nutrition plan with women living in Chester County who do not fit the federal definition of food insecure to see if their perception of food insecurity currently affects their purchasing of healthy foods, creates personal stress, and requires them to make purchasing sacrifices that could affect their future health. Questions for the key informant interviews were grouped into 4 groups. First was to establish if participants are experiencing insecure emotions toward food purchases, even though they don't meet the federal standards financially as food insecure. The second grouping is to analyze if participants' insecurity feelings are related to perceived barriers of the availability of healthy foods in the geographic area. The third grouping of questions is to determine if participants experienced perceptions of barriers such as food availability and costs of food. Finally, the last grouping of questions looks to determine if participants would take advantage of interventions, such as coupons and or discounted pricing to relieve some food insecurity feelings. Although the data for this study was limited, the conversations and questionnaire responses from interviewees confirmed that food insecurity perceptions happen at many different economic levels in Chester County. Food insecurity is not only about the financial means to purchase foods, but also the perception of lack of convenience, accessibility, availability, and the stress during poor economic periods, such as what we are experiencing in society today. Participants of this study have barriers and stressors, as do local food pantry participants, that do not prevent them from having food in their home, but do require them to think twice about choosing quality and making those sacrifices. Data from the interviews confirmed that women don't see others with food insecurity, but behaviors such as traveling outside the area to purchase foods or to access healthy foods and making choices to not purchase healthy foods show that women of all economic levels in the region are showing behaviors common with food insecure. Many women experiencing food insecurity in Chester County are well educated and have good nutrition knowledge and understanding. But the risk from food insecurity perceptions not only affects future consequences of nutritional status, it also has an impact on future consequences of physical, social, and emotional health, as well as the quality of life and BMI for women. It has been shown that in women aged 21 to 39, body weight is affected by food insecurity. For example, 37% of the women surveyed in a household food insecurity survey had a BMI greater than 29, which is considered obese, compared with 26% of women in food-secure households. Although this study was on women aged 21 to 39, the concern for women in Chester County over the age of 51 is that they may experience increased BMI from perceptions of food insecurity as well. Campbell indicated that consequences of food insecurity, such as nutritional status and health consequences, are correlated with poverty. But in the case of women in Chester County, no one can predict what feelings of food insecurity may have on women's future health. Participants of a qualitative study looking at needs and perceptions of healthy eating among food insecure showed that participants had adequate nutrition knowledge, but eating behaviors were strongly influenced by 4 factors: health-related topics, social and cultural influences, influenced by physical environment, and financial influences. Participants of the study were conscious of their financial situations and stress and developed positive strategies to cope with the limited budget. However, this Chester County study showed that a significant number of participants did not have positive strategies and instead chose to purchase less healthy foods, travel longer distances for food, and substitute less healthy choices to save money. So, what can we do to help women in Chester County? Well, we can start by asking women, our patients, our customers, and our clients, questions about food insecurity and food insecurity perceptions. That's a start. Acknowledging and validating that these feelings are real and showing compassion, empathy, and understanding toward their situation is crucial. All of the interviewees stated that they would benefit from coupons and discounts from local restaurants. As stakeholders, coming up with special discounts or providing coupons to women who answered questions that show food insecurity would offset the high costs of services that are common in the region. Using various social media sites and Facebook community pages, such as West Vincent Voices, Euclid Ramblings, Downingtown Moms, is an effective way to distribute coupons and discounts, as well as using county websites such as the Chester County Food Bank, Chester County Health Department, and the Chester County Hospitals. Another option is to raise funds for the food bank, such as selling and distributing discount coupon books from local businesses, restaurants, and farm markets. That could be used as a fundraiser for local schools and sports teams. Youth could pre-purchase the coupon books at discounted prices and sell them to raise funds for the food bank while supporting the local businesses. Providing services that are convenient to women may alleviate stresses and allow them the convenience of making healthy choices. This would allow women returning home from work to quickly acquire local produce without having to enter grocery stores that have low-quality food options such as processed foods. Policy changes are crucial. Local governments and policymakers can have a large impact on wealthy counties' food insecurity by providing resources outside of food banks, which have been seen as unsuccessful for high-income food insecure. One intervention that women in the region could benefit from is an increased local tax credit based on the number of people living in a household. That increased income would allow recipients to have additional money to use towards the purchasing of healthy foods, which may reduce anxiety and other psychological stressors. In Pennsylvania, those making less than 160% of the federal poverty line are eligible for SNAP compared to other states such as New York, whose income threshold is higher than 200% of the federal poverty line. The low threshold in Pennsylvania prevents 56% of Chester County food insecure from being eligible for SNAP because of their income level alone. The results of this community needs assessment will help determine and provide evidence to support a state-level increase in SNAP benefit allowances over the current $34,068 allowance, and increase the income threshold for Pennsylvania to 200% of the federal poverty line to help food insecure women living in this region qualify for SNAP benefits. Without increased benefit options to purchase healthy food items, women may become more reliant on fast food or convenience stores for cheaper food options for themselves or family. SNAP payment cards would allow for discreet purchasing of healthy foods from grocery stores, which would benefit recipients' health with reduced BMI, higher intake of fruits and vegetables, and lower obesity risk. Chester County is a rural community that could be vulnerable to an influx of fast food restaurants as cheap alternatives to grocery stores. Data from the 2005 Michigan Behavioral Risk Factor Telephone Survey showed that obesity rates increased by 24% when individuals increased their frequency to fast food restaurants, and that number increased to 33% if their frequency increased to 3 times per week. Allowing the rural communities to continue with full-service restaurants, which were associated with a negative weight difference compared to fast food eating, may help keep Chester County women healthy. Combating food insecurity perception is the key. The health and wellness impact of food insecurity and food insecurity perception on 51-year-old women and older in Chester County is relatively unseen and unstudied, but the consequences may be coming down the road. To prevent increases in BMI among women, mental health concerns, and to break down barriers of stigma, this community nutrition assessment suggests that stakeholders take an active part in supporting the needs of women through discount pricing, coupons, food bank fundraising, And it's also suggested that local government have more involvement in healthy food availability with increased tax credits for women and improved zoning to increase healthy food markets